The cost of healthcare in America has ballooned over the last 20, 30 years, and it's not because doctors cost more to the system. Healthcare has skyrocketed because for every doctor, you need like 10 to 15 administrators. It's literally a disaster.
Is there a solution?
No.
I mean, why are some of these surgeries so expensive? Because you see in the US, it's like $250,000 for a surgery, but then you'll see it done overseas for 30 grand.
The number one reason that I see it happening here is because we don't have transparency in pricing.
America doesn't have a healthcare system. It has a toll booth. Every year, millions of Americans do everything right. They work, they pay taxes, they buy insurance, and then, when they finally need care, they're handed a bill that feels like a punishment for getting sick in the first place. A broken arm costs 5 figures. A short hospital stay wipes out savings. A single prescription can rival a monthly rent payment. And yet we're told this is the best system in the world. That lie has been repeated for so long that most people don't even question it anymore. But once you slow down and follow the money, a very different picture emerges. One that explains why healthcare in the United States isn't expensive by accident. It's expensive by design. Americans are told they have choice. Choose your insurer, choose your plan, choose your doctor, as long as they're in-network. But real choice requires transparent prices. And in U.S. healthcare, prices are deliberately hidden.
They billed our insurance company over $3 million for the cost of transplant. Then I have another EOB right after it, which was another $1 million. So you're looking at a $4 million transplant. I don't know what people do without insurance. How could you even begin to pay that?
Before procedure, you're rarely told what it will cost. After the procedure, you receive a bill that looks less like an invoice and more like a foreign language. Codes, adjustments, negotiated rates, denials, appeals. This isn't complexity, it's camouflage. In any normal market, you see the price before you buy. In healthcare, you only see it after, when it's too late to walk away. And that's the first red flag.
My son's secretary and I spend a lot of time taking care of just medical bills and phone calls and that type of thing.
Insurance was supposed to protect people from catastrophic costs. Instead, it became the gatekeeper to care itself. Over time, insurance companies stopped acting like safety nets and started acting like profit-maximizing corporations. Because that's exactly what they are. Publicly traded, shareholder-driven, legally obligated to prioritize returns. Every denied claim saves them money. Every delayed approval earns interest. Every confusing policy reduces payouts. So insurers built systems that quietly say no as often as possible. Not always directly, sometimes through paperwork, sometimes through prior authorizations, sometimes by forcing patients and doctors into endless appeals. Most people don't fight back. They don't have the time, the energy, or the legal knowledge. And insurers know this. Here's a fact that should end the debate immediately. The same drugs made in the same factories by the same companies cost dramatically less in other countries. Not a little less, sometimes 80 to 90% less. So what's different? In other countries, governments negotiate drug prices directly.
Basically, they have to do what they're told. They are told by the government in what range they can charge. They're told what health procedures they can fund. And they are told by the government who they can accept as clients. So they're really just carrying out orders.
They're basically charities. They don't exist to make a profit for investors like American health insurance companies. They're there to keep people healthy. That's what they're there for. They follow all sorts of rules that American insurance companies wouldn't dream of.
In the US, for decades, the government was legally blocked from doing that. Why? Because pharmaceutical companies spent years lobbying Congress to make sure they never had to negotiate with the largest buyer on earth, the American government. Instead, prices are set through a maze of rebates, pharmacy benefit managers, insurers, and middlemen. Each one takes a cut. Each one adds opacity. Each one inflates the final price. By the time the drug reaches the patient, it's unrecognizable from its original cost. And if you can't afford it, that's your problem. Politicians often claim they're helping Americans by subsidizing healthcare, but look closely at where that money goes. In many cases, subsidies don't reduce overall costs. They simply guarantee revenue to insurers. Taxpayer dollars flow into the system, premiums continue to rise, and insurance stocks soar. Over the last decade, some major insurance companies saw stock increases in the thousands of %. Patients didn't get richer. Coverage didn't get simpler. Care didn't get cheaper. But shareholders won big. That's not a failure of policy. That's the policy working exactly as intended. Hospitals aren't innocent either. Many operate like regional monopolies, quietly buying up competitors until patients have nowhere else to go. Once competition disappears, prices skyrocket. A saline bag that costs a few dollars, billed at hundreds. A routine scan, marked up beyond reason. And because prices aren't posted, patients can't compare. They can't negotiate. They can't opt out. Hospitals justify this by pointing to insurance negotiations, administrative costs, and compliance burdens. But again, follow the money. Executive compensation climbs. Billing departments expand. Administrative overhead explodes. Meanwhile, doctors burn out. Nurses quit. Patients drown in debt. In the United States, medical debt is the leading cause of personal bankruptcy.
If you're watching this video, you probably know somebody that filed a bankruptcy because of medical bills, which, by the way, out of all the bankruptcies done in America, 66.5% of all the bankruptcies are due to medical bills, according to American Journal of Public Health. That's a lot of bankruptcies. And by the way, out of those people that filed bankruptcies, 72% of the time they had health insurance. So wait a minute, you have health insurance. How did you file bankruptcy? How do these guys make money? What is this health insurance business? Why do so few people trust it? How do hospitals make money? How much do they charge? What is their profit margin? Who's being held accountable? Are health insurance companies making the money and saying, good for you, I already got my money. Your problem is the government not collecting money. Is the hospital not getting the money for anybody? But who's paying for all this stuff? And at the same time, all the politicians don't want to talk about Medicare, Medicaid, let alone Social Security, because God forbid if they say the right thing to do is we kind of got to get away with this stuff. They're not going to get reelected, so they want to keep getting reelected. So they keep saying, you cannot do this, it's not fair. But guess what? At whose cost? At whose expense? At Gen Zs? At Millennial? At Gen X? So these guys are probably never going to get any of this stuff, but they finance it for them? Why is that fair?
Let that sink in. Not luxury spending, not reckless behavior. Getting sick. People with insurance still go bankrupt. People who did everything right still lose everything because the system doesn't exist to protect them. It exists to extract from them. And once you're trapped in medical debt, the consequences ripple outward. Ruined credit, delayed care, chronic stress, worsening health. The system feeds on its own damage. If there's one reform that terrifies entrenched interests, it's transparency. Real transparency. Not PDFs buried on obscure websites. Not incomprehensible spreadsheets, but clear posted prices, up front. Because once people can compare costs, the illusion collapses.
Up in the hospital can be scary. You're sick and you have no idea what it's going to cost to get better. The federal government wants to make things easier by requiring hospitals to list prices online. 2 weeks into this new law, Channel 2 Investigates is checking to see what those lists look like and how easy they are to navigate. Investigator Bill Spencer found that even healthcare experts had a tough time figuring it all out.
Why does the same procedure cost $2,000 at one hospital and $20,000 at another across the street? Why does one insurer deny twice as many claims as its competitor? Why do profits rise while care deteriorates? Transparency doesn't just inform consumers, it exposes the scam, and that's why it's resisted so aggressively. Every broken system has winners. In U.S. healthcare, they're easy to identify. Insurance conglomerates protected by regulation. Pharmaceutical giants shielded from negotiation. Middlemen paid for complexity. Lobbyists writing the rules they pretend to oppose. These groups don't want reform. They want control. Because control means predictability. And predictability means profit. Real reform would shift power away from them and back to patients. That's the real threat. Perhaps the most effective part of the system isn't economic. It's psychological. Americans are conditioned to believe that suffering is normal. That confusion is inevitable. That bankruptcy is just bad luck. They're told, this is complicated. This is the cost of innovation. This is freedom. But freedom doesn't mean being afraid to see a doctor. Innovation doesn't require financial ruin. Complexity doesn't excuse exploitation. Other countries prove this every single day. So here's the uncomfortable truth. If the US wanted affordable healthcare, it could have it. The money exists. The models exist. The data exists. What's missing isn't intelligence. It's political will. Because fixing the system would mean breaking the revenue streams of some of the most powerful industries in the country. And they won't go quietly. When something fails for decades, despite endless reforms, it's time to stop calling it broken. It's working for someone. The American healthcare system doesn't optimize for health. It optimizes for profit extraction at every stage of illness. And until that fundamental incentive changes, nothing else will. The question isn't whether the system can be fixed. The question is whether Americans are finally willing to admit they've been trapped inside one of the most sophisticated financial machines ever built, disguised as care. Because once you see it, you can't unsee it. And that's when real change becomes possible.